Welcome to HITea With Grace, where we spill the tea on HIT. I'm thrilled to be here in sunny Las Vegas at the Health Conference to learn from the industry's greatest leaders about trends in digital health and beyond. First up is Dr. Patricia Hayes, Chief Medical Officer of Imagine Pediatrics. Thanks for joining me today, Dr. Hayes.
Thanks for having me. I'm so happy to be here.
So tell me a little bit about the career path that brought you to your role today and what inspired your focus on improving care for children with special healthcare needs.
So I started out my career post training and residency in community health centers. So really caring for the underserved folks who have difficulty accessing the healthcare system. And it's always been a passion of mine to take care of these families and to ensure that they were able to have the same type of healthcare that everybody else has access to. And Imagine Pediatrics was redefining what it was for children with special healthcare needs, particularly children on Medicaid, to have access to a navigation and services and care coordination that allowed them to be able to really be in this healthcare system that is oftentimes so challenging for these families, exist in a healthcare system that is full of barriers, social determinants of health, issues that they face, and be able to thrive, really.
Wow. So, Imagine Pediatrics, like you said, it's really redefining care for children with these special healthcare needs. And so, you kind of mentioned too, this kind of tech-enabled multidisciplinary model. What makes your approach different, and how does it strengthen rather than replace existing care teams?
So, our care is wraparound care. We can stand in the gaps when families need us, but I think what we are able to provide through all of our tech enablement is really a proactive approach to taking care of these kids. Our systems take in so much data from health information exchanges, from ADT pings from emergency rooms, behavioral health facilities. We take in pharmacy data, clinical data, remote monitoring, and really paint a whole picture for our care teams to be able to know what's going on with these patients in real time and be able to lean in and provide a proactive instead of reactive service. A lot of these kids are going into systems where it's often fully reactive. They're going in because they're already sick. They're going in because they've already missed their medication. They're going in because they've already missed appointments with their specialists, their regular providers. So our care is fully proactive. It's there to make sure that they don't, find themselves in these gaps, and we can lean in where we need to with that multidisciplinary care.
So let's talk a little bit more about keeping those kids having safe days at home. Mm-hmm. What does that look like in practice, and how do technology and data make it possible?
So safe days at home for us means, can we keep these kids in their communities? Can we keep them at home? Can we keep them, at school? Instead of spending unnecessary days in emergency rooms and inpatient facilities, can we wrap around them so that we can identify areas where we can, again, lean in and make sure that they don't end up in a place where they don't need to be? Of course, these kids are really sick, so sometimes they need to be in the emergency room. Sometimes they need to be in the hospital, but as much as we can prevent that and have this care team that's we've got physicians, we've got nurses, we've got community health workers, social workers, behavioral health therapists, pharmacists, really be able to identify where their needs are and support them in ways that keep them out of unnecessary care settings.
When it comes to children with special healthcare needs, how do current Medicaid and pediatric care policies help or hinder the ability to deliver more coordinated at-home care?
I think one of the difficulties in our current system is just access. There are very few people who, take Medicaid. Medicaid doesn't reimburse well. So oftentimes providers and health systems don't want to engage with folks that are on Medicaid. They don't want to deal with the burden of billing and trying to get reimbursement from Medicaid. They're often, complicated populations to manage and to care for and can be expensive. And so for us, being able to practice in a value-based care way really aligns quality outcomes, positive outcomes with the way we are paid and reimbursed. I think that's what really allows us to be different, is that we don't have to operate in a fee-for-service environment where it's super transactional. You are dealing with having to care for people in small increments of time and sort of this churn and burn environment where you aren't paid necessarily for quality outcomes. You're paid for that reactive care. You're paid for people to be admitted inpatient. You're paid for them to come into the emergency room. And I love the ability, even especially as a physician, to be able to practice in an environment where I get to be paid to take really good care of people. And I get to be paid so that they don't go to the emergency room and they don't have to have unnecessary visits and inpatient admissions. It's great.
Absolutely. And your model integrates not just medical and behavioral care, but also social support, things like housing, transportation, food access. How are you tackling these social drivers of health to create better outcomes for families?
Sometimes it's just about taking the time to ask. We do a ton of surveying. We do just a lot of questioning when we start, engaging with our patient population, saying like, what are your biggest barriers? What are your challenges? What can we help with? And sometimes it's not the medical issues that they're dealing with. It's that they don't have food to put on their table. It's that they can't make their appointments because they don't have transportation. They don't have secure housing. And so we've got an amazing team of social workers and resource specialists who are embedded in the communities that we serve, in the states and the regions that we're serving, and know what's available. They spend time with these patients. Again, not this, rapid fire transactional experience. They really know these families and they can support them with whatever they need from a social determinant of health focus. And they do a beautiful job really being able to not only identify what these families need, but to be able to find them resources to overcome the challenges that they're having.
As technology, policy, and value-based care continue to evolve, what gives you the most optimism about the future of pediatric healthcare, especially for families facing the greatest challenges?
I'm optimistic to be here. I'm optimistic to see that folks are developing technology, they're developing care models that allow us to take better care of not only kids with special healthcare needs, but all patient populations. It's exciting. I think, I've been practicing physician for a really long time, and it's a space where it's kind of interesting in healthcare. We're both like very future focused, but then also the practice itself is very behind the eight ball on being innovative and finding new ways to take care of folks, because the ways that we get paid and the ways that our systems are set up are very, not innovative. So, I'm excited that we're finding ways to increase access through technology. We're finding ways to share data better so we know our patients better. Data is a huge challenge to be able to take care of patients, just being able to actually know what's happening to them in real time and where they go when they step outside of your office or your hospital system. I'm thrilled to see that people are building things that allow us to be more proactive in caring for families and not just being really reactive to what's going on.
Absolutely. And giving parents and families what they're asking for, what patients and caregivers. And, as we kind of close this part of the podcast out, why children with special healthcare needs?
What's crazy is that though they're a smaller part of that patient population, they account for over 50% of the cost of the healthcare costs. So
I'm literally jaw dropped right now.
Because people think of kids as generally healthy, right? And I think that's why a lot of healthcare and innovation in healthcare specifically is not geared towards kids, because they think, kids will be fine. Like, kids are healthy. They don't really need a lot of support. But, there is a percentage of them that are really spending a lot of time inpatient, spending a lot of time navigating a difficult healthcare system that need that support.
Now, my listeners love to hear about trends that are happening in the space, but they also love to learn about what drives women leaders like yourself. So tell me, what are things that you do in your daily life that help you work your best to make a difference?
I think trying to be really close to the folks that are day-to-day practicing in our current healthcare system, and practicing even within Imagine Pediatrics, and just trying to gauge from them what are the challenges that they're seeing, what are the barriers that our patients and their caregivers and families facing, and how can we help them show up better for these families and for the patients. And spending time too with our amazing patient family advisory council that really helps to shape what we do at Imagine and tell us, is the product that we're putting out is it really going to change their trajectory? Is it going to is it responsive to the things that they need and the things that they're saying that they need? And I think it's just that information gathering. I'm like to know what's going on. And I think you can move really far away from what's happening in leadership. And you've got to stay kind of close to the ground and ears to the ground.
Love it. And as a women leader, obviously you didn't just get to women leadership, where it's just all of a sudden a leader and didn't have to experience any trials or challenges on your way. What are some strategies that you've put into place to help overcome some of these challenges that have come your way?
Being really open to hearing hard feedback. I haven't always been a great leader. I talked to a group of leaders at our company recently and was sort of a lessons learned and said, I've made my mistakes. And I think the biggest thing that you can do is take that feedback, learn from your mistakes, and, consider it a gift. They say feedback is a gift. And if you don't take it, you won't grow. And I think a really important thing for people to know in leadership is that you're going to make those mistakes and you have to get back up, learn from them, and keep moving forward. Because if you don't learn from them, you won't be a good leader. And if you don't have mistakes and you don't make mistakes, you won't be a good leader.
Truly inspiring. Do you have any other advice that you'd like to give women leaders that are transitioning from clinical and provider world into the tech world? What do you want them to know?
It doesn't have to be a scary place. I didn't ever think that I would end up in a health tech startup. And, I took a chance, and it's okay to take those chances. They were really scary. I was in a really happy place in my career before this opportunity came knocking. And I thought, what do I have to add to this? What do I have to bring to this company? And you have your experience. You're open-minded and you're willing to take a chance and jump into a new experience. I think that's the best thing you can do. It really makes you grow and is really exciting, but it can be scary. So I just say, if it's scary, take a chance.
I absolutely love that. As we're kind of thinking about the next, if I were to give you a crystal ball and we're thinking about the next 5, 10, 15 years in the world of improving care for children with special healthcare needs and really trying to keep them at home as much as possible in that process, what innovations do you see really coming into play? Or is it an innovation in policy, or is it innovation in tech, or is it all of the above? What are you hoping to see in the next 5, 10, 15 years?
Yeah, it's a lot of it. Policy-wise, I think we need to be on the forefront of advocating for care models that align quality outcomes with payment. That is a huge need because, people are saying Medicaid's expensive, Medicare's expensive, caring for people. Yes, it's expensive, but it doesn't have to be as expensive. We can find ways to keep people healthy so that they don't, again, spend unnecessary time in the hospital and, fall ill, and then we're doing reactive care. I think policy is a huge space right now, and it's a big deal. We're seeing a lot of changes. We're seeing a lot of cuts in funding for children and adults, especially in the Medicaid space. But I think as long as we continue to pour work into the spaces that create care models and incentives for caring better for people, I think we could be okay. And I think again another thing that's on the horizon is just all of this integration of technology with care. Not, again, paper charting. I was a physician in paper charting. I remember it. It was terrible.
Wow.
Could you read even the notes that somebody had left for you about a patient? And it's so wonderful to see the amount of data that we have access to and the amount of opportunity that we have to share that data across health systems and to be able to, again, know what's going on with our patients and give them technology too, like we do at Imagine Pediatrics, to engage with us and to provide us data and to have that more immediate access to the care that they need.
Terrific. Now, to finish this conversation off right, where can our listeners find you online?
I am on LinkedIn. You just reminded me I may need a more active social media presence, but LinkedIn, absolutely.
I love following you on LinkedIn, so absolutely check her out, folks.
Yeah.
Thank you so much for joining me today. I loved spilling the tea with you.
Thank you. Appreciate you having me.
And thanks to you folks for joining me too. Check out the HITea With Grace podcast website for more interviews with great guests like Dr. Hayes today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.